Immigration enforcement. That is posing twin threats to healthcare for immigrants. One, patients are afraid to show up to medical appointments.
We had patients call us and say, I'm not going to seek healthcare ever again.
The second threat, it's to healthcare workers themselves. Doctors, nurses, home health aides are being detained, deported, or losing their visa status.
It's not just in rural America. It's not just in urban cities. We really see it nationwide.
Patients too afraid to get care, certain workers disappearing. Today, what happens to people's health and to the healthcare system when immigrants become federal targets? From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. One month after President Trump took office, we aired a story about how the administration's amped-up immigration enforcement was impacting the health of immigrants and how clinics and providers were responding. We talked to CommunityHealth, a clinic serving about 5,000 Latino and Polish uninsured and often undocumented immigrants in Chicago. CEO Steph Willding told us their patients were scared and many were staying away.
We provide care to folks who often cannot get care anywhere else. And we are an island of safety for our communities. But in that moment, it felt like it still isn't enough.
CommunityHealth, like many clinics, tried to reassure their patients. They did more virtual appointments. They added security, trained staff on how to respond if ICE showed up. Steph was hopeful but unsure if these steps would make a difference.
If you want to meet the moment, doing things in new and different ways is going to be how we can best serve the community.
A year later, Steph says, despite their best efforts, patients are more scared than ever.
While we did our best to meet our patients where they were at, to get them as much care as we could, ultimately there's a limitation to that.
There's been a 17% increase in people not showing up to their appointments. That's hundreds of people skipping checkups, vaccines, follow-ups. Most of their appointments are now done via telehealth, which has jumped 733% compared to a year ago. And Steph says this applies to all of their immigrant patients, regardless of their legal status.
We've seen immigration enforcement is being pretty non-discriminate in terms of whether you have paperwork or not.
The Supreme Court has given ICE the green light to stop and question people just based on their physical appearance and language. Steph remembers last October during a major ICE surge in Chicago when a city official got detained at a hospital. She could hear the helicopters and sirens because it was just down the block from the clinic.
I'm picking up the phone, calling my operations person and saying, we have to lock the doors. We have to lock them right now. Because we just didn't know what else was going to happen.
The idea of ICE coming into a hospital or clinic used to be unthinkable. There was actually a federal rule prohibiting it. But Trump rescinded that rule, moving the front lines of the immigration fight inside clinics like CommunityHealth.
In the month of October alone, nearly every day, one of our locations had to go into lockdown, or our staff had to shelter in place due to either ICE activity in the area or ICE clashing with community in the area that made it not safe for them to leave the building.
Steph says ICE has never been inside one of their clinics, but they've had to increase security, trading safety for the sense of welcoming they used to prioritize.
And now we have to lock our doors? There's just something that's not right about it. All we're trying to do is give healthcare to people.
CommunityHealth is obviously just one clinic in one city. So we asked Tradeoffs reporter Julie Wernow to talk with other providers and researchers about what we've learned after 1 year of Trump's increased immigration enforcement policies. Hi, Julie.
Hi, Dan.
So just to set the stage for everyone, nearly 70,000 people were in immigration detention earlier this month, up from about 40,000 when President Trump took office. Most have no criminal convictions, and the administration has sent thousands of ICE agents to major cities, including Chicago, Memphis, and most recently, Minneapolis. Julie, What do we know about the impact all of this is having on the ability of immigrants to access care?
Well, all across the country, Dan, people are avoiding care. The New York Times and KFF, the health research group, found that nearly half of undocumented adults they surveyed have skipped out on medical care since January 2025 over concerns about their immigration status. Now, 14% of immigrants with legal status are also not going to the doctor. So overall, 4 out of 10 immigrants, including naturalized U.S. citizens, say that this fear is negatively impacting their health.
Negative impacts, Julie, like what?
Well, worsening health conditions like diabetes or high blood pressure. It's also things like increased stress, anxiety, problems sleeping. And we know from research that this kind of chronic or toxic stress can increase rates of diabetes, heart disease, asthma, even cancer.
My guess would be it is too soon to have anything besides survey data about how people's health is being affected. Is that right?
Yeah, that's right. Researchers told me it's going to take a while to know exactly how these immigration policies will impact people's health. But several also told me that COVID could be a good parallel because so many people avoided care then. And we pretty much saw every health condition get worse. For example, cancer survival rates dropped, anxiety and depression rose 25% in a year. Dan, going into this, I expected that there would be a lot of people no longer getting care who needed care. But what I was surprised about was the undocumented people who are getting care and what that looks like.
What are you talking about, Julie?
Well, like you said, Dan, there's 70,000 people in ICE detention right now. Reports of inadequate care in these facilities are rampant and horrific. Measles outbreaks, mistreatment of pregnant women, 2 nurses to care for 1,500 detainees because of staffing shortages. The Department of Homeland Security has vehemently disagreed with these reports. Their chief medical officer in a press release said, quote, "This is better, more responsive health care than many aliens have ever received in their entire lives." I talked with an emergency room doctor, Hannah Janeway, who works at a few hospitals in LA, including one that's right near a detention facility. So ICE agents are bringing detainees in there for medical checks.
When patients come in ICE custody, a lot of times they're injured, they're terrified. They're brought in usually by officers who are, a lot of times they're wearing full ski masks.
Hannah says doctors are concerned whether patients are getting their meds because the detention facility doesn't have a contract with a pharmacy.
I still remember the face of one woman I treated who was pregnant and had a urinary tract infection, and I discharged her back to custody with an antibiotic, which I'm now concerned she never got.
These conditions, Dan, make it hard for Hannah and other clinicians to really do right by their patients. Hannah told me that staff have a moral and legal responsibility to fight for their patients, and legal experts told me ICE detainees do still have a right to speak with medical providers in private. But Hannah says ICE agents just ignore these requests to leave the room. So doctors will write on a scrap of paper, "Tell me how to contact a family member," like when an agent's back is turned.
Whenever I'm standing up to an ICE officer insisting that I talk to the patient in private and they're physically intimidating me, my heart is beating fast. These are just doctors trying to be doctors and trying to provide the best care for their patients. And I know how difficult that can be.
So, Julie, it sounds like between people avoiding care in the community and immigrants in detention receiving inadequate care, the administration's immigration policies here are having a pretty negative effect on people's health. Is that the takeaway?
I think that's one takeaway for sure. But there's another one. I visited Tuskegee, Alabama during the pandemic. That's where Black men were told they were being treated for bad blood in the 1930s, when actually they were being allowed to live with untreated syphilis long after there was a treatment. It's been nearly 100 years, and the impact of that broken trust still makes people suspicious of public health. Jordan Herring, a researcher at Stanford who studies healthcare access for underserved people, told me immigrants who've seen ICE raids at hospitals or had their health records shared with the federal government are likely to remember this for years.
The core of this issue goes to like trust in healthcare providers and trust in public resources. And so that's going to be difficult to repair.
When we come back, the impact immigration enforcement is having on the healthcare workforce and what that has looked like for a group of community health workers in Chicago. Welcome back. In the first half of this episode, we talked at length about the impacts all these immigration enforcement actions are having on the health of patients. There was this sense that an entire segment of the population is reliving the pandemic. They're avoiding healthcare settings. Virtual visits have risen dramatically. Clinics are starting to worry about people with heart conditions and diabetes. Tradeoffs reporter Julie Wernow is here talking with us about this. So, Julie, now let's talk about the people who are providing the care, the workforce, right? What's happening with immigrants who are in healthcare?
Well, Dan, to put this slice of the workforce into some context, a recent study found nearly 1 in 5 people working in healthcare are foreign-born. That includes 1 million who are not U.S. citizens. So obviously, the U.S. healthcare system relies on these people. We're talking about primary care docs, surgeons, dentists, and we both know there's already worker shortages. I mean, there's, 193,000 vacant nursing positions? Stanford researcher Jordan Herring says these immigration crackdowns are exacerbating some of the most acute.
Home health care aides, psychiatric aides, medical assistants. In some places, that's like a fourth, a half, maybe even the majority of those positions are immigrants.
So Julie, what are we talking about here? I mean, we're a year into these immigration enforcement efforts. Do we have any idea how many foreign-born healthcare workers have stopped coming to work?
Yeah, I mean, the truth is it's really hard to keep track. By one tally, President Trump took more than 500 actions on immigration just in his first 12 months. So we're talking about mass deportations, suspending refugee admissions, travel bans. And a lot of it is getting challenged in court. So people are told to leave, and then suddenly the courts say, no, you can stay. I mean, it's totally a moving target. Nobody I talked to had specific numbers on people dropping out of the workforce. But what is clear is there's a lot of chaos out there, particularly for people who are trying to fill all these open positions.
It is literally all hands on deck.
To get a better handle on this, I called Laura Messineo. Laura is the chief nursing officer for Worldwide HealthStaff Solutions. It's a staffing firm for international healthcare workers. She told me that even in the best of times, hiring immigrant health workers and relocating them can take over 2 years. So when these bans come down, it just upends tons of planning. She told me this crazy story about this Nigerian nurse that was approved to move to Iowa. And then the president added Nigeria to the banned list, so they had 2 days to get her stateside.
Quickly packing, quickly getting on a plane. I mean, that's saying goodbye to everyone. Not an ideal situation.
Laura got that nurse to Iowa, Dan, but Laura's struggles are just one example of how these immigration policies are having an impact on the workforce. For clinicians who serve immigrant communities, the job has really gotten harder. There's this one clinic in Minnesota that really captures what I heard. Patient no-shows there are up 30%, and that's pretty demoralizing, right, for the staff. And then people who do come in have some pretty intense trauma now. There's a lot of telehealth visits, so doctors and nurses are just stuck on screens for hours at a time. The burnout is real.
Julie, talking to the folks in Minnesota or wherever, what really stood out to you?
People are really scared. I heard from healthcare workers in 10 states, and most of them were too afraid to speak with their names or use their voices, even anonymously. That clinic in Minnesota, workers are walking around with photocopies of their passports because they're afraid they're going to get stopped by ICE agents.
And that fear, Julie, is another hidden way the workforce is taking a hit?
Yeah, some people have actually stopped going to work, or at least stopped going into the office. In Chicago, I talked with a woman who supervises 4 promotoras. These are community health workers for the organization Enlace. It's in the neighborhood Little Village.
Hi, my name is Sahida Martinez.
Little Village is a low-income neighborhood. It's got the highest rate of uninsured residents in the city. 25% of people here, so 1 out of every 4, are undocumented. Before ICE showed up last fall, Sahida and her promotoras would fan out across this largely Mexican-American community to encourage people to take care of their health, like get free checkups and attend mental health support groups. She told me that she and her team have spent several months grappling with whether or not to go back to work in person, meaning both at the clinic and just walking around the neighborhood.
Why did they stop working in person?
Well, Sahida said she and her coworkers are all immigrants, and some of them are documented, some of them not. Regardless of their status, they're worried about getting hurt or being deported. But they're also worried that in hiding from ICE, they're invisible for the people that they're trying to help.
Teníamos que buscar el equilibrio porque también la comunidad también nos necesitaba.
She said their community needs them, and they didn't want to let them down by shutting themselves away.
Y que no queríamos escondernos.
So it sounds like they're trying to figure out what to prioritize, their own personal needs or the needs of their patients.
I think that's right. And after talking to Sahida, I really do understand why she and her team are so afraid. Sahida gave me this great description of her neighborhood. She said it's usually a place where the bells of street vendor carts jingle and cars cruise by slowly, and you'll hear music when you're walking down the sidewalk. And that all changed last September.
Era un silencio.
She said there was just silence.
Un silencio que lastimaba.
She described it as a silence that felt like missiles sent to shut them up.
Como si fuera misiles contra ti y contra tu comunidad.
With ICE agents all over the neighborhood, Sahida tells me living in Little Village these past few months felt like being in a movie.
Como una película de ladrones.
Like a heist movie, where she and her neighbors are the villains, being hunted by big men with angry faces.
Nos sentíamos así que estaban persiguiéndonos a todos.
I also talked to Jadhira Sanchez, Enlace's community health director. She says one day shortly before the new year, ICE agents arrived at the clinic's door.
So that day it was like 7 vehicles, all tinted out, all officials, all scary men. And we had staff arriving. Staff was caught outside in the streets. They tried to check them and pull them out of the vehicles. They started taunting our staff. They tried to open our building doors.
I feel like I was in a time of war.
That's Sahida saying she felt like she was living in a time of war.
It is. ICE ended up leaving before they got inside, but the incident deeply affected Sahida and her staff. One coworker started to have panic attacks and dreams that ICE agents had taken her. She's a widow with 2 young kids.
Lo que más me dolió de esta promotora fue cuando una vez ella me dijo.
Another coworker with 3 kids kept saying how she'd never forgive herself if her kids got deported.
Que dijo, mi hijo no tiene la culpa, que yo lo traje.
Because she was responsible for bringing them to the United States.
Mi hijo no tiene por qué pagar mis errores.
Julie, given these risks, why did these community health workers think it was so important to be meeting with people in person?
Honestly, it's because they all remembered how badly things went during the pandemic. Sahida told me a lot of people died, and maybe fewer would have died, she thought, if they had been able to meet with people face to face. Instead, the promotors were working from home and trying to do these wellness checks on people virtually. Basically, Dan, the pandemic taught them that they have a lot more impact when they meet people in person compared to over a screen. And that's just as true now with the ICE actions as it was during the pandemic.
Did the promotora's work suffer when they went virtual this past fall?
Yes, because people weren't reaching out for virtual support. They were afraid that the government might be listening.
No noise, no nothing, no calls in our telephones.
Sahida and her coworkers understood that they were helping a lot less than they wanted, during this moment of profound need.
Julie, this feels like an impossible choice. I get that they want to do more, but given the stakes for people, potentially breaking up families, what did Sahida and the team do? What did they decide?
Well, she put the question to her coworkers.
Yo pensé que ellas me iban a decir otra vez que no.
And going into the meeting, she was worried that some would want to keep working from home and others would want to come back. She was totally shocked when they all said that they wanted to come back.
Wow, vamos a regresar.
And why did they want to come back?
Well, for one, they felt like being home alone actually increased their own fears. And being around each other, they thought they'd feel more supported, more grounded. Being in person would feel like they were actually fulfilling their mission.
Tengo que hacer mi trabajo. Quiero seguir haciendo mi trabajo. La gente me necesita.
Dan, her coworkers just sat down and started filling out the schedule.
Que hacerlo virtual. Nadie se quejó. Al contrario, ellas mismas empezaron a decir, yo voy tal y tal día, y yo tal y tal día.
I'm thinking about this small team of healthcare workers in Chicago, Julie, and wondering what this looks like more broadly. You say that about 1 in 5 people who work in healthcare are immigrants. If a chunk of people stop coming to work, what's the spillover to the larger healthcare system?
Well, if there are fewer healthcare workers coming in to fill the gaps, it's going to be a thing. One study found that when immigration enforcement increased during the Obama administration, a bunch of foreign-born home health aides just stopped working, and that made it harder for people on Medicare to get long-term care. So we could be talking about less support for our aging parents and grandparents. And Laura Messineo, who works at the International Healthcare Staffing Agency, says fewer nurses and doctors will mean longer wait times and less personalized care.
Someone who wants to have a primary care visit with a physician, you may have to wait for a new patient appointment for 9 months. That's today. So I think it's going to get worse by threefold.
Sahida and her coworkers have been back outside working since when?
January.
And what did she tell you about how things have been going since then?
I actually got a text message from her a few days ago. Let me pull it up.
Okay, great.
She told me people are slowly coming back outside. They're getting food. They're returning to their support groups. She said, quote, I think the community is tired of being afraid, and we no longer want to live locked up like during the pandemic.
Julie, thanks so much for your reporting on this story.
Thanks, Dan.
I'm Dan Gorenstein. This is Tradeoffs. Time and again, big tech companies have promised they're poised to transform healthcare.
IBM's Watson may be the technology that helps doctors beat cancer.
We will change the face of healthcare. I am absolutely positive about it.
Only to flame out and fade away. Will this new wave of artificial intelligence meet the same fate? In his new book, A Giant Leap, physician and writer Bob Wachter catalogs healthcare's painful history with new technology and shares why he's cautiously optimistic this go round. That's next time on Tradeoffs.
Thanks for listening to Tradeoffs. If you've just discovered us, remember to subscribe to the feed so you never miss an episode. Subscribing is free and easy on whichever podcasting app you use, the NPR app, Apple Podcasts, Spotify, wherever you listen to podcasts. The Tradeoffs team is producers Julie Werno and Melanie Evans, senior producer Leslie Walker, managing editor Ryan Levy, managing director of partnerships and growth Eleanor Coetzee, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Special thanks this week to Arturo Bustamante at UCLA, KFF, and the many clinicians who spoke with us anonymously for this piece. Thanks also to all our listeners who helped to support our work, including Ann Lasco, Kate Baker, Liz McLaughlin, Elizabeth Munich, Louise Relling, and Bob Stryker. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Sozoze Foundation, the Foundation for Opioid Response Efforts, the National Institute for Healthcare Management, the California Healthcare Foundation, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.